Welcome to the deep dive. We're jumping straight into a pretty serious public health alert today.
Yeah, it's concerning. We're talking about a measles outbreak in the upstate region.
Exactly. So, our mission here is to really break down the health reports we've seen, look at how this is spreading, what the real risks are, and crucially, what preventative steps officials are recommending right now.
And the context is important. Normally an outbreak means 3 or more cases.
Right. But we're already at 8 reported cases. And the really striking thing, 5 of those just popped up in the last 2 weeks. That feels fast.
It is fast. And that speed changes things. Initially, officials linked the cases back to international travel. Someone brought it in.
Okay, so imported cases.
Exactly. But this recent surge, these 5 new cases, that's shifted the whole picture. Now they're calling it community spread.
Which means it's circulating locally, person to person.
Precisely. And they're associating some cases with a school. They haven't named it, but they're definitely expecting more cases to surface.
Wow. Okay, and there's a critical detail in the reports about who's getting sick.
Mm-hmm. This is maybe the clearest point. Every single person infected so far was unvaccinated.
Every single one.
Yep, unvaccinated and had no natural immunity from, having had measles before.
That is stark. It really highlights the vulnerability there.
It absolutely does. And when you think about measles, it's R naught value, the basic reproduction number. It's somewhere between 12 and 18.
12 to 18, that's huge.
It's one of the most contagious diseases known. So one person can potentially infect like up to 18 others if the population around them isn't immune.
So if you don't have that vaccine shield.
You're wide open.
Okay.
And you potentially become part of the spread very quickly.
Which really underscores why public health folks talk so much about herd immunity, right?
Exactly that. For measles, you need vaccination rates way up there, close to 95%, just to protect the small number who can't get vaccinated.
Like infants too young for the shot, or people with weakened immune systems.
Right. Those vulnerable groups rely on the community's immunity. Yeah. When you see community spread like this starting up, it's a sign that maybe that local immunity level has dipped below that critical 95% threshold.
And that puts those vulnerable people at immediate risk.
It does.
So let's talk about why this is such a serious alert. People might just think measles, oh yeah, the rash I got as a kid, but the complications are the real worry here.
They absolutely are. We need to be really clear about who's most at risk. It's young children, people with compromised immune systems, and also pregnant women.
Okay, what kinds of complications are we talking about?
For young kids, the most common cause of death from measles, believe it or not, is pneumonia.
Pneumonia, okay.
But there are other severe risks too, like inflammation of the brain, encephalitis. That can lead to permanent issues like hearing loss or intellectual disabilities.
And I read something about neurological issues showing up much later, years later.
Yes, that's SSPE. Subacute sclerosing panencephalitis. It's rare, thankfully, but it's devastating.
How does that work?
It's a progressive neurological disorder that can develop like 7 to 10 years after the person had measles. The virus essentially lingers and reactivates in the brain, causing progressive and ultimately fatal damage.
Wow, that's terrifying. It really puts a heavy emphasis on just preventing the initial infection altogether.
Absolutely. Prevention is everything with measles.
Okay, so let's shift to what people can do, what they need to know right now. What are the specific symptoms you should be looking out for?
The typical pattern starts with a high fever, cough, runny nose, and red, watery eyes, kind of like a really bad cold or flu.
So not the rash first.
No, that's key. The rash usually develops a few days after those first symptoms kick in. It often starts on the face and then spreads down the body.
And crucially, you're contagious before that rash appears.
Yes, that's a major challenge for control. You're typically contagious for about 4 days before the rash shows up, and then for about 4 days after it appears.
4 days before it. So you could be spreading it without even realizing you have measles yet.
Precisely. That's why it can spread so quickly in communities that aren't well vaccinated.
Okay, so given that, what are the main recommendations coming from health officials for the public?
It boils down to 3 key things based on these reports. 1, if you're sick with those kinds of symptoms, fever, cough, runny nose, red eyes, stay home. Don't go to work, school, or daycare.
Makes sense. Isolate yourself.
2, if you do need to see a doctor because you suspect measles, call the office ahead of your visit.
Why call ahead?
So they can take precautions, maybe have you use a separate entrance, or go straight into an exam room to avoid exposing anyone in the waiting area. It's highly contagious through the air.
Got it. Good heads up. And the third thing?
Get the MMR vaccine. Measles, mumps, rubella. Officials emphasize that it provides lifelong immunity and it's incredibly effective.
Lifelong immunity, that's powerful.
It really is. And looking at the bigger picture, this outbreak, well, it's kind of a textbook example of infectious disease dynamics.
Oh, so?
You have a virus with that really high R naught, that 12 to 18 number, hitting a population where immunity might be dipping. The result is almost immediate spread. It shows how individual choices about vaccination directly impact community safety.
Right. It's not just about protecting yourself.
Not at all. It's about protecting everyone, especially those who physically can't be protected by the vaccine themselves, like tiny babies or people undergoing cancer treatment.
So wrapping this up, what's the takeaway for you listening? When you hear officials talking about lifelong immunity from the MMR vaccine, think beyond just personal health. It's about maintaining that community shield.
That shield protects the most vulnerable.
And that final thought we pulled from this is really about that term, community spread. What does it mean to rely on others, on your neighbors, on your community, for your health security, or for the security of the most vulnerable people you know? It's not abstract. This outbreak shows it's very, very real.